Bismillahirrohmanirrohim. Assalamualaikum warahmatullahi wabarakatuh. Good morning everybody. My name is Wuri Ratna Hidayani from Stikes Respati in Tasikmalaya. I would like to presentation my journal by title Analysis of Knowledge of Senior High School to Singaparna student about epidemiology of sexual transmitted infection and lesbian, gay, bisexual, transgender in 2019. Background. In 2012, there were 357 million cases of sexually transmitted infection in the world. In Indonesia in 2016, as many as 61,000 cases. West Java was the highest rank of STI in 2012. In 2016, the highest prevalence of STIs was gonorrhea, 3,430 cases. Several independent surveys state that Indonesia has 3% of LGBT population or around 7.5 million people with LGBT of 250 million people in Indonesia. Preliminary study in December 2018 counseling guidance teachers state that most of the knowledge of high school students did not yet understand the epidemiology of sexually transmitted infection and LGBT. It is feared that students do not know the preventive risk of transmitting sexually transmitted infection and LGBT behavior. Method. The population in this study were all students of senior high school to Singaparna in the 2018 or 2019 school year. The sample of this study was students of class 12 by purposive sampling totaling 29 high school kids in January 2019. Data collection using questionnaires and in-depth interview. When the study was conducted on the date, place of research in the senior high school to Singaparna. Data analysis was carried out from information that was obtained at the stage of research data collection from the result of interview and open questionnaires. This analysis used two variables, namely STI epidemiology, STI risk factor, STI classification, and LGBT, which include definition, LGBT sign, impact, and prevention LGBT. Number 3, result. Number 1, knowledge of STI epidemiology. A. Knowledge of STI triad epidemiology. Based on the result of the study notes that the number of respondents was 29 students with a majority of 18 years. Interview results about the knowledge of epidemiology of sexually transmitted infection. Students from 29 students answered the same as follows. Epidemiology of sexually transmitted infection caused by virus a people at risk are commercial sex worker. Sexual deviation is good children. Homosexual or M is M, man likes men, lesbian. The STY environment is largely by changing partner behavior, injecting drugs. By senior high school to Singaparna student. B. Knowledge of STY risk factors. Student knowledge of STY risk factors based on interview which 29 students states the same as follows. Risk factor for sexually transmitted infection are partner changing behavior, drug abuse behavior, such as injecting drug, sexual deviation, such as sodomy, rape, unsterile blood transfusion, or virus contamination by senior high school to Singaparna student. G. Knowledge of STY classification. According to the result of interview with 29 students, the knowledge of the STY classification states that sexually transmitted infection are HIV or AIDS and uterine cancer. STY classification is HIV or AIDS, syphilis, and gonorrhea by senior high school to Singaparna student. Number two, knowledge of LGBT. Number A, knowledge of LGBT definition. There are students who do not know the meaning of the extension. In addition, there are those who explain about the definition of LGBT only mentioning physiological disorder and sexual orientation disorder. LGBT is a case that is being widely discussed worldwide. LGBT is an extension of lesbian, gay, bisexual, transgender is a case of sexual deviation that is rife among men and women by senior high school to Singaparna student. Based on the result of interview with students state that LGBT is a deviation that violates norm and religion. According to student statement, it has been mentioned in detail the length of LGBT and the meaning of the term LGBT according to the following information. LGBT is deviant behavior that violates religious norm. Lesbian is a lover of the same sex, normally woman like woman. Gay is a man who likes the same sex between men and men again. Bisexual is a lover of all types, also likes both between men and women. Transgender is someone who changes the genitals such as woman into men. By senior high school to Singaparna student. Big knowledge of the cause, impact, and prevention of LGBT. Prevention by good religious education, so that's as a foundation of deviation and sexual orientation interview can be seen that the causes of LGBT are as follows. There are so many causes of LGBT, not only a matter of lack of faith, but because of education and surrounding environment. Not a few LGBT also occur because of the consent for someone and dissatisfaction with the nature that should be. The impact of LGBT on the surrounding environment that is contagious. LGBT can damage the nation's future impact on oneself that can be alienated by his friend or become material for bullying. LGBT can be prevented by several things, including deepening the faith of piety, deepening knowledge about LGBT, knowing the impact of LGBT by senior high school to Singaparna students. Prevention is the right parenting and encouraging faith according to the following information. The cause of LGBT is the association that causes LGBT poor socialization of the community, loss of parental supervision, environment, lack of confidence. The impact of LGBT, among others, causes the large number of LGBT communities undermining the morale of the nation can destroy the present and future generation. Prevention of LGBT, among other faith that must always be instilled early on. Parent educate a child by instilling Islamic Sharia. Parent educate their children according to the shape of the child, that is from the game, or by educating hard on boys. Parents must instill good morale from the early age. Love, unfortunately, from childhood is the base of the success of children in the future. Parental supervision must be observant of the child behavior of if there is a change in a behavior in children. By senior high school to Singaparna children. Discussion. Based on the research result of 29 students, it can be seen that the student knowledge about STY epidemiology is still limited. Only a little is known about STY epidemiology from the agent aspect, only fixed on HIV or AIDS, which is transmitted by viruses. Apart from environmental factors, most respondents answered only at risky sexual behavior. According the research of below, 20, eh, according to the research of below 2020 states that knowledge about STYs is very important because the data of knowledge in the community, including the age group 15 to 29 year, as a basis for information in intervention to control the prevalence of STY by means of preventive promotive effort to increase knowledge, for example by promoting the health of STYs epidemiology. Encouraging the role of teacher in motivating students, especially guidance counseling teacher to continue to socialize the importance of students in understanding about LGBT. The role of homeroom teacher and subject teacher, as well as the participate in socializing about the danger of LGBT. The role of religious teacher also continues to be improved to guide students in increasing faith and piety so as to provide a firm foundation with a strong religious profession. The principal policy is also very important to create a religious school for the inculcation of religious values for children so that students are not easily influenced by distorted thinking that's drag on behavior that violates the norm. This is consistent with the research of Haas et al. 2011 on studies of suicide risk factor caused by LGBT states in the United States that's based on a survey of 34 respondents living in various countries, people who engage in same-sex marriage have the potential to experience anxiety, mental disorder, treasure for suicides compared to heterosexual couples. Con- Conclusion: the knowledge student, senior high school to Singaparna student of STI epidemiology, namely student only know the STI disease agent, which is virus, whereas STI's agent vary, including viruses, bacteria, parasites, fungi. These factors that are known to student are behavior, sexual deviation, and blood transfusion without screening. The STY classification that shouldn't now only mention the STY classification as HIV or AIDS. Only one person mentioned HIV or AIDS, uterine cancer, syphilis, and gonorrhea. The knowledge of senior high school to Singaparna student about the danger of LGBT, namely the majority mentioning the length of LGBT without knowing the meaning of the term from LGBT. Student knowledge of the causes only mention wrong pattern of care, lack of faith, association, even though there are still many factors causing LGBT. Thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh.